Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York. I have an interesting case today with a shoulder pain. Today we're going to do the exam. We did already the neural tension tests, all were positive. She has a severe positive neural tension tests, all of them, the radial, the ulnar, the median nerves. This is beyond the scope of the video because I already done. I want to see my patient sign. She has severe positive Addison sign, and she asked me what is that. I told you before, guys, if you see the other videos on my YouTube channel, Cure Within Your Hands, we spoke about Addison sign. And I graded Addison sign in my 5th DVD. And I graded to severe, moderate, and mild. And what is Addison sign? Addison is the name of the doctor who discovered this sign. And why is it so important? Addison would check the pulse, and the pulse is not there. And why we check it? I suggest for my people who watch me, and we do with all my patients, anybody come to my office with a shoulder pain or a neck pain, should check the pulse first.
Right.
Okay, why? Because the pulse I can palpate, I can detect, but the nerve I cannot detect easily. You can feel it, the numbness, the tingling, the pain.
Yeah.
But if you want to know the nerve, you check the pulse. Why? Because the nerve, the artery, and the veins travel together. It's something called the neurovascular bundle, one bundle. And they travel between one big muscle called the scalene. So what is scalene? The scalene is the muscle that comes on the side of your neck on both sides. One is scalene here, left or right. And the scalene, let's say, is like the deltoid. The deltoid muscle is this muscle. It has anterior deltoid, middle deltoid, posterior deltoid. The scalene is the same. It has anterior scalene, middle scalene, posterior scalene. It's like that.
Right.
The scalene attaches from down to the first rib.
Right.
And the first rib is like this. It moves something called bucket handle motion. Bucket handle like this. So the scalene holds the first rib from the middle, like that, and it lifts the first rib up, like bucket handle, to increase the vertical dimension of the chest, to increase the air. So mainly scalene is accessory respiratory muscle. It's supposed to work only if you are competing in running, and climbing the stairs or swimming.
Right.
It's not supposed to work when you're resting at all, when you're supposed to be relaxed. But with the life stresses, work and family and tension here and there, we appreciate your effort as working mother and daughter and family and stuff. So something called, we have two systems. We have the autonomic nervous system has two parts. One called the sympathetic and one called the parasympathetic. Sympathetic is a fight, is a flight, is the one make you ready. Is the one who works during the day.
Right.
You run, you fight and flight. And parasympathetic is supposed to work at night. We sleep and rest, digest food, make love, empty the urine, empty the bowel, empty the stomach, like that. Sometimes when the sympathetic is overactive all the time, so the scalene going to spasm, and it stays spasming all the time. So pull the first rib up and keep it up all the time. And let's speak now about the scalene. The neurovascular bundle, back to the neurovascular bundle, it travels between the anterior scalene and middle scalene. When the scalene spasms, it squeezes first between the anterior and middle scalene. Squeeze the neurovascular bundle. Not only that, sometimes the neurovascular bundle passes between the anterior and middle scalene. After that, it passes under the collarbone. It is the collarbone, and the first rib is here. So the neurovascular bundle, the artery, the nerve, the vein, travel together after passing between the anterior and middle scalene, under the collarbone, and above the first rib. So if the scalene pulling the first rib up, it squishes, it compresses the neurovascular bundle again between the two bones, the first rib and the collarbone. So now we check the pulse, I check it in here, it's not there, it's called severe. Because what is not severe? It's not severe if you check here is there, and if I take it behind your back and I check, and I see it is not there, it's called moderate. I take your hair, pulse it there, move your hand behind your back and it's not there, it's called moderate. Okay, if I take it behind your back and it's still there, and only move your neck down, this side or this side, move your neck up, and it stops. It's called mild because only your neck, your hand is behind your back, and it only stops when you move your hand. How I treat that is very simple. The first thing we need to do, we need to relax the scalene muscle, because if you squeeze between the anterior scalene and middle scalene, and we relax the scalene muscle, the pressure going away, most likely the pulse will come back.
Right.
How we do that, there's many ways to relax the scalene. The best way, which I like to do the best way, is a way that was found 120 years ago. Dr. Lawrence Jones has made a lot of research. He had 50 years of research, and many doctors after him did researches. It's called the counter stroke, which said that we shorten the muscle. If you shorten the muscle, make it too short, assure it, the muscle gonna relax. Because the muscle is spasms. If the muscle keeps strained for a long time, it's gonna spasm. It feels gonna tear. To protect the tear, gonna spasm. So when you shorten the muscle, it means like you're relaxing the muscle. You shorten it, make it short, so it relaxes. Muscle for a period long enough, the muscle will be assured. Muscle has memory.
Right.
We should believe that, because if you don't believe the muscle has memory, how come you believe that the chip card in the phone has memory? The phone has memory. Metal, you have a muscle has memory too. So when you assure the muscle that no more strain, the muscle will relax and your pulse come right away.
Okay.
95% of my patients get this the first visit. The other 5% they get better within 4 visits.
Right.
Okay. First, we're going to shorten the muscle. Most likely, the pulse will come. If we shorten the muscle, the pulse didn't come. So most likely the rib is stuck up, and we have to push the rib, push it down with the hand, push it down with the hand, and just press. The first rib is very short. It's here, it runs in here. As you see, scalene here was breast was tender. When I pushed it, it was tender. He was hurting, and I feel it here. And this is the first rib here. If I push, sometimes I put a tennis ball here and push it and stretch it like so. Push the first rib down, the pulse will come back again.
Right.
Okay, this is gonna work. This is gonna get first thing when I treat now is, and I suggest everybody watching me to do this first. If pulse is not there, we need the pulse to go there. Why?
Right.
Because no pulse is no blood. No blood is no regeneration. It's gonna be degeneration. If you have injury, you have something in there, the blood need to go with the nutrients, with the oxygen for the tissues and cells to work properly. If no blood, no enough oxygen, no enough blood, you're gonna be only wear and tear, no building, only destruction, which is not good. We need to get the blood to go there first for the healing, for the nerve to heal. After we get the blood there, so we're gonna take care of you have the nerves, you let it squished in there.
Right.
We're gonna mobilize the nerve, flossing. The nerves are very strong. So after you cook them, you cannot even bite with your teeth because they're very strong. So just when you mobilize the nerve, you floss it the same way you floss your teeth. The nerve will make space for itself because it's too strong. The only problem with the nerve, realize the nerve mobilization is the nerve, sorry if you put your finger here and move it fast. Try to do this, right? You're gonna feel like heat and something, but it's not good. Same when you mobilize the nerve between the tissues, create for itself, the nerve had a sheath. The same way if you don't work all the winter in your garden, and now with spring you come out to work with the garden and all the tools, your skin get like inflamed, they get some blisters. 1 week you keep working, this will be gone. It's gonna give you suffering for 1 week. After that, the skin will be strong and you can hold the tools and gardening tools and work on the problem. Same with the nerve. First 5 visits, first week or 2, maybe the nerve get inflamed, give you more pain. It doesn't mean the treatment is not working. The treatment is working, but we have to go through this. Same way you have to go work in the garden to be able to work. You have to go through this layer. Your skin gets better. The same with the nerve, mobilize it, make the sheath to get stronger, to be able the nerve mobilize it and make space for itself. The nerve is very strong. I'm gonna start treatment now. Do you have any questions before we start?
No.
I'm gonna start treatment now.
Great.
Do you mind staying in the film while doing this? It's okay?
It's okay.
Sure. I'm gonna put the zero here, the left shoulder. And I'm gonna cover you. Give me a big towel you have Mercedes, please. Lie down here, sweetie. Oh, sorry. Are you okay? Are you okay?
Yes, I'm good. Okay.
This is your left shoulder. Okay, the way you do counter strain for the scalene, just relax, please. Leave it for me completely. Leave it for me completely. I want to shorten the muscle. I'm going to take your head to my side very slow and like just relax. This works 100% for people who can relax. And this is a passive technique. Here,
I'll try to.
you relax, I do all the work.
Okay.
If there's something hurting, just raise the other hand. If you
Yeah.
want to speak, raise the other hand, and it is hurting. I'm going to push this up and hold this here. And I can use my leg to push here and give my hand in
If
there.
I can take the pain, I won't say anything.
You have the pain?
If I can take the
yeah,
pain,
I
I
should.
won't say. If it's
Sure.
sharp, I'll say something.
Okay. How is any pain now?
Okay, a little bit.
Where?
Here.
Shoulder? Okay. I'm going to take it. Let me check the pulse. Yes, congratulations. Pulse is there and strong. I told you 95% of my patients come right away. Okay, this is counter-strain Lawrence Jones. It's got better within less than 30 seconds, guys. Okay? Okay, that was good. Okay, now pulse is here. And this was the screen spasm. And you check now here, gonna be no pain as before. Still hurts or better? Here.
No, better.
Better, yes?
Better,
See, this
yeah.
was hurting before a lot, yes?
Yes.
So now we got the screen spasm off, and you're lucky, the pulse is there now.
Okay.
This number one in the step. Okay. The second step when you should take it. We did the exam today, something called the neuromuscular technique. Yeah, yes. We did the, I'll just cover my patients. If it's too hot, speak up, okay?
Yes.
If it's too hot, let me know. If it's too hot, you like it?
Okay.
Okay.
Yeah, I like it.
Okay. So, we're gonna do the neuromobilization. I did this, guys, in a previous video, how I treat the neck pain, and I did the neuromobilization. Just go look how I treat neck pain. I explained all the neuromobilization before. Now I did something called the neuromuscular technique exam. I examined my patient, which is tender. She had tenderness over the upper trapezius, over the levator scapulae, over the latissimus dorsi, over here in the low back. Latissimus dorsi comes from here, guys. And I wanted my young doctors to know that the main muscle that keeps the humeral head in its place in the glenoid is the latissimus dorsi. So we need to release the latissimus dorsi. But I want to tell you guys, we have tender points in the muscles. We have tenderness over the scalene, which got better, over the upper trapezius, over the levator scapulae, over the latissimus dorsi. This called, I want to know what those are secondaries or primaries. I checked the upper traps and the subscapularis. Please do this with every patient you have with a shoulder pain. I pulled the arm out and I checked, and the subscapularis was very tender. It was a primary. If I treat the primary, the secondary is going to surrender. Now I'm going to treat the subscapularis now, and we're going to film after that. I'm going to treat subscapularis, give them patient privacy. I'm going to treat subscapularis muscle. After that, this is the primary. When the patient going to feel better, tenderness will be better on she had tenderness on upper traps, and the latissimus is going to get better as well. Thank you.